So in this class, we are going to see about various types of medical diagnostic methods, tools, or normally known as the scans or the X-ray, various different types of these imaging systems, which are used commonly in both diagnosis as well as the treatment. So the medical imaging techniques, especially in the modern medicine. Without this, almost nowadays, no treatment is being taken. Even if the fever, if it is lasts for more than 3 days, then the patients are asked to go for either blood test or the scan reports, depending upon the conditions. So the medical imaging is a kind of a technique wherein we can get to see what is happening inside the body without opening it or without doing any surgery, so that we can diagnose the kind of disease, nature of the disease, the level of damage, the veracity of it. And accordingly, we can make the treatment protocols. And also, it will be highly helpful in monitoring the progress and plan the prognosis accordingly. So, this is inevitable for a doctor or a medical practitioner to know about these methods. What all the methods are available, why they are used, which type is used for what, in that what they are going to see. By seeing that, what we decipher or what we make out, what we understand based on the reports, that is very important, because nowadays if you see, only two types of patients are coming to the alternative medicine as a whole other than allopathy. It's not only for acupuncture, but for even the Ayurveda, Ayush in collective, it's alternative medicine, all other than allopathy. These are only two categories. One is that they will go to the allopathy, they will do all the treatment, all the things and all, and that's not worked out well. Further, more complications have come. Then they will look out for some other options available outside the allopathy. Is there anything that I can look for? Or is there any other systems of medicines through which I can get the remedy? By the time they think, they would have gone to various hospitals or doctors or specialists, and finally they will come to the alternative medicine guys. Second guy, of course, the percentage will be very, very less, wherein they have a clear understanding about the entire medical system, and they know which one is good, which is having the side effect, which is a long lasting one, which is addressing the root cause, which is a symptomatic one, all those things. Having understood in detail about what they are experiencing. Nowadays, everything is available there in the social media. Nowadays, even the artificial intelligence have come. So if you properly use that, you don't require anything for gathering the information. We cannot say that as the knowledge, but the information. And when they come to us, or the alternative medicine guys, they'll be having fair idea about almost all the jargons, all the mnemonics, all the medical terminologies. A guy who has already taken the treatment from the allopathy and other things and all, when they come, they will come with a bunch of reports. They will say the terminologies that are mentioned there in the report. Sir, tracheostomy has been done, craniectomy has been done, oophorectomy has been done. Can you treat this? Have you seen such cases? So before that, we need to see, understand what actually
And
they
Baps.
are mentioning. For that, you need to have basic idea and understanding about various tools that are available there in the modern medicine and try to understand the reports by studying that. For that, definitely you need to have the basic understanding and idea about the anatomy and physiology. Without anatomy, it will be very, very difficult for you to understand the report, because when they mention specifically, everything will be there, the medical terminologies. With those terminologies, if you are unable to understand, then you will be blinking in front of the patient. And once the patient, the first impression, no, when after he sees your face with full confusion or something, that blank out, or you don't have any clue about what the disease, then that placebo effect is gone. So it is paramount important for every one of us, if you are there in the medical field, either as a therapist or you have your own clinic or you are assisting someone, you need to have thorough knowledge about the anatomy and physiology. So that is the basis to understand the reports. So in this session, we are going to see what are the various methods or types rather of these medical imaging techniques, how it is used, what is the difference, what is the advantage or disadvantage or the limitations of individual methods, and then in general, overall, how to read a report, what are the things normally to be mentioned, what are the major contents of a scanned report. So that's what we are going to see in this session. So each scan has a unique principles, benefits, and applications. Of course, they have their own limitations also. And why we use the medical imaging? One is that for early diagnosis. That is, we can detect the conditions well before the symptoms appear. Most of the conditions, like in the case of cancer and all, normally we'll get to know that the patient after second or third, majority of the case, third or fourth, only they are able to get the symptoms. Similarly, heart disease, only when you get the symptom of angina, chest pain, difficulty in breathing, gasping, or something different, then only you get to know that there is some problem. But if you use early diagnostic methods, it will be easy for us to address that. Then it helps in accurate detection. Exactly. So in the areas like brain and all, exactly at which area, at what depth, what level, whether it is in the gray matter area or in the white matter area, or whether it is up to what level. So it helps in pinpoint exact location and also the severity of the disease. So in the case of fractures and all, what is the level of fracture? Different types depending upon the condition of the fractures, it's named differently. Accordingly, the treatment procedures also varies. And it helps in the treatment. So what to be done, how to be done, what are the things to be combined, all those things. And during the course of the treatment, we can also use this for monitoring the progress, what has happened, how, whether the tumors or the bone joining, in the case of fractures and all, whether it is joining, whether it is narrowed down, tumor shrinkage or expansion or same level, all those things. And this is non-invasive one. Invasive in the sense just inside of the body, without that, non-invasive. So internal study without opening it, cut opening it. So in this medical imaging, what are all the things that normally to be considered are some basic. One is that the radiation exposure. It's a very, very important one in the medical imaging. The radiation exposure will cause definitely some effect in the body. So the X-rays and CT involves the radiation only when if you feel that the benefit is more than the risks involved, or that is, say, unavoidable, then only you advise for the X-rays or the CT scans. And certain imaging systems, the contrasts are used. The angiography and all contrasts are used. In certain CT, the contrasts are used. So these contrast chemicals or the dyes, they may cause allergic reactions for some persons. And then the cost, depending upon the type of the scanning, USD is less cost or cheaper, and the MRI or PET will be highly expensive. And all the hospitals may not be having this PET scan or MRI scan facilities. Claustrophobia is a kind of a fear like being in a confined area, certain persons. So when a person is put into a tunnel kind of a thing, MRI scanners and all, they will feel like, some kind of phobia, the fear. So now we will see one by one what are all the imaging methods commonly being used. First one is the basic one. It's a very primitive one, commonly used one. That is X-ray, radiography. Here, the ionizing radiation is used to capture the 2D image of the internal structures. So the dense structures like the bone absorb more X-ray, and that will appear in white color. Whereas the soft tissues are the hollow one, that will absorb less X-rays. That's why they appear like dark, thick one, blackish. So where and all commonly this is used is, one, to study about the bone, any deformities or the fractures in the bone or the joints like bone fractures, joint dislocations, or in the case of, say, rheumatoid arthritis and all, or osteoarthritis in the joints, to study the level of damages. And another commonly used area is to study about the lungs, to know about pneumonia or the tuberculosis, because there it can be easily identifiable because of that contrast, white and darker differentiation. If it is darker, there is no solid material like mucus or no other masses there. And this can be used to detect any foreign objects. And in case of dental imaging, that is commonly being used. The major advantage for this is it's very quick, fast, and inexpensive. Within 10 to 15 minutes, just get inside, take, come out. Another 15 minutes, the reports will be ready. It's very cheap also, and it's commonly available in all the area centers. And this is very good for the dense structures like bones. And the limitations or disadvantages of this is you will get a poor soft tissue contrast. You cannot make out exactly, especially the soft tissues. Another thing is that exposure to the radiation. Oh, frequent exposure to radiation will cause so many complications, including mutations happening there in the cell level, and that would cause so many problems, including cancer. And next one is CT, commonly known, computer tomography, CT or CAT scan. So here also X-rays are used, but in a rotating way to create a cross-sectional images, that is slices. Here the computer processes the data into a 3D images it creates. It's one of the commonly used one for almost every area, but mainly like head injuries, strokes, brain tumors, and all to study the brain. It's widely used. Then chest and abdominal imaging for any tumors or abnormal growths or something, and also for detecting some cancers and the level of spread, which is called metastasis. In the case of trauma or internal bleeding, and also for fractures in the bones. The advantage here is we can get to see a detailed 3D visualization. It's a fast scanning one, so that it can be performed in the emergency condition immediately after the trauma or the emergencies. It's highly preferred one for the fastness. Here, unlike the X-rays, it can detect soft tissues and bone abnormalities also. The limitation related to this CT scan is high radiation exposure. And the cost wise is also more, not like X-ray. Third one is MRI, that is magnetic resonance imaging. It's also commonly used wherever you are not in a position to get a clear image or view or study about the condition from the CT scan. Normally the doctors would prefer to take the MRI and study in detail about it. So here the strong magnetic fields and also the radio waves are used to create the images based on the hydrogen atom distribution in the tissues. Here there is no radiation involved. It's only through magnetic fields. The common usage, almost similar to CT, this is used in almost entire area of the body, that is brain, spinal cord, and also the nerve imaging can be done here. Ligaments, tendons, soft tissue injuries, tumor detection, metastasis, and joint and musculoskeletal imaging. It's widely used throughout the body for all the conditions wherever it is needed. The major advantage with this is there is no ionizing radiation involved, and we can get very high contrast images of soft tissues. And this is useful for neuroimaging and also orthopedics. The disadvantage or the limitations related to the MRI scanning is that expense. Another thing is it's a time consuming. Unlike CT, this takes a pretty longer duration to get the scanning done. And it'll be too noisy and not suitable for the patients with the metallic implants. That is very, very major disadvantage. If you have any metallic implants in the body, if that is MRI compatible, stainless steel or some other material, that's okay. However, any iron based one, because of the magnetism, that will have the problem. Next one is the most commonly used one and cheaper one, and very friendly one is USG, ultrasound sonography, where the high frequency sound waves are used, which bounce back from the tissues and reflect back to produce the real time images there based on the reflection and refraction. So commonly used to study the abdominal organs, all the abdominal organs like liver, kidney, gallbladder, spleen, and also for fetal imaging during pregnancy, obstetrics. And to study about the blood flow is proper blood flow is there, especially study about the arteries and venous conditions. The Doppler ultrasound is used mainly to study about the heart, and also any DVT, deep vein thrombosis kind of conditions are there. Then for thyroid, breast, testicular evaluations, all commonly used. Major advantage is that in this there is no radiation, and it is the safest one because it's even the pregnancy it can be used. And this is portable and affordable one, simple device. And it's a real-time imaging, useful for biopsies, and also we can study directly. In the case of pregnancies and all, the movement of the fetus, the conditions, all those things. But the limitation for this is it's highly subjective, in the sense it's operator dependent, depending upon the knowledge, proficiency, experience of the person who operates it, the radiologist or the doctor. And poor penetration through the bone or air-filled organs, that is lungs, and also even you could have seen many of the reports of the abdomen and pelvis where they would have mentioned because of the bubble gas, it's not fully seen. Body of the pancreas is not seen due to bubble gas. Many of the conditions where the patient is having constipation and liver issues, who are likely to have more bubble gas, this problem will be there. That's specifically mentioned. So the effectiveness of the study will not be there compared to other methods because of this, because the penetration level. That is one of the major disadvantage with that of the ultrasound. Then comes PET scan. Normally we hear about the PET scan only for cancer patients. Here a radioactive tracer is injected into the body that emits the positrons, which are detected by the scanner, so that we can study about the metabolic and the biochemical activity that is happening there in the body. So positron emission tomography, mainly used to detect and also for the staging, which stage or the level of metastasis of the cancer. And in the case of brain, the activities happening there in the brain, mainly the atrophy, level of atrophy that is happening with mainly the diseases like Alzheimer's or Parkinson's or cerebral atrophy, even cerebellar atrophy, which is comparatively less common than the cerebral atrophy. and to some extent the heart diseases like myocardial viability. The advantage with the PET scan is it detects diseases at the early stage because we are getting the functional imaging. Functional imaging is the one which gives an idea about the performance of the individual tissues there. So, on this often be combined with the CT or MRI, PET CT or PET MRI. Major disadvantage with PET scan is that it's highly expensive and it involves radiation exposure. And most of the centers, this will not be available. It's not widely available in all the centers. That is another disadvantage. Immediately, if you want to take, you have to go to the hospital or the center where this is available, big centers only. Then another scan which is very, very less heard about is SPECT. That is single photon emission computed tomography. CT is computed tomography. Here, the single photon emission. This works similar to PET, but uses gamma emitting radio tracers. And it creates the 3D images of the blood flow and also the mechanisms. So, this is commonly used in cardiology for the study of myocardial perfusion imaging, heart muscles. And then bone scans in the case of cancers to understand the level of spread of cancer, that is metastasis. And also in the brain imaging to study about the stroke and also the epilepsy. Now, this is also a functional imaging one, similar to PET, and the traces last longer than PET. That is another advantage. But the disadvantage is that compared to PET, the resolution normally here in SPECT will be less. This is lower resolution. And then radiation exposure. That is the major disadvantage with this. Another commonly used by the female patients is mammogram, where low dose X-rays are used to study about the breast tissues to check normally for any breast cancer. So commonly used for breast cancer screening and also for evaluating lumps and microcalcifications, small calcifications, hardenings. So with this, small tumors can be identified in the early stage itself, and it's a non-invasive one. Major disadvantage is that because of the compression, the patient may undergo discomfort, pain. And some cases we will get to see some false positives or false negatives also. So the accuracy is not that dependable. Another less heard one is DEXA scan, which is used to study about the bone density, bone densitometry. Metry is measuring, so bones density, to measure the bones density. So here the dual energy X-ray absorptiometry, DEXA. So dual energy X-ray absorptiometry is measuring the bone mineral density. Mainly this is used to diagnose the osteoporosis or osteopenia condition, mainly related to the bones condition, and also to assess the fracture risk because of the poor density or strength of the bone, especially used in elderly persons, mainly for the ladies, where because of the low estrogen level, which involves in the vitamin D and also the calcium metabolism in the body, that also having connections with the thyroid and parathyroid hormones. So such cases, the onset of osteoporosis is more common. So the persons who were having PCOD in the early fertile period, after the menopause, they may likely to develop osteoporosis. The probability is very high in such cases. The advantage with this is it's accurate, fast, and the radiation is also very, very low. But the disadvantage with this is it's limited only to the bone density. It's not used for any other diseases. And the next one is again a less commonly heard one is fluoroscopy, wherein the real-time moving X-ray imaging is done, often used with the contrast agents, fluorescence, fluoroscopy, especially to study the GI tract, the barium studies. Then in case of cardiac catheterization and guided injections and surgeries, these contrasts are used to do that. And the visualization is a dynamic one, commonly used in interventional procedures, operations, major operations and all. The disadvantage with this is, or the limitation with this fluoroscopy is the continuous radiation exposure, because it's an ongoing one for a long time. So continuous exposure of radiation is a major problem, and it needs a radiological contrast sometimes. So that is the another disadvantage with that. Next one is endoscopic ultrasound, EUS, where the endoscopy is combined with the ultrasound to enable close imaging of internal organs, mainly via GI tract. Mostly used endoscopy is used to study about the GI one, gastrointestinal tract related one. To study any tumors or masses, lesions or something there in the GI tract, pancreas and all, liver and bile duct evaluation, and also used in lymph node biopsy. Now, the advantage is that we will get high resolution images in this, and can perform needle biopsy during the scan. That is the simultaneously, by seeing that if any mass is there, directly you just take out some tissue from the tumor to do the biopsy. The disadvantage is that it is an invasive one, where you do the damaging or cutting or taking some tissues, invasive, and it requires sedation. Next one is angiography. Angiography, it's very common. So this can be used combining CT or MR or digital subtraction. So based on that is to visualize the blood vessels by using contrast dye and then imaging using either X-ray or CT or MRI. So the types depending upon the radiation, the rays used, whether it is CT angiography or MR angiography or digital subtraction angiography. This is used to detect any blockages or aneurysm. Aneurysm is bulging of the blood vessel where the wall of the vessel is weakened like a balloon it comes. And often if it is there in the brain and all due to sudden high BP, this aneurysm will burst and may cause the stroke, hemorrhagic stroke. And also to study about the clots and blockages, any kind of thrombus, embolism. Heart and brain vessel imaging is commonly been studied using this angiography, and also to do any guided vascular surgeries. So this is mainly related to the vasculature, that is blood vessels. Advantages is a detailed blood flow images we can get, and we can detect life-threatening vascular conditions, whether it is a block or a kind of aneurysm that may burst and may cause hemorrhage. We can get to detect. Limitations with this angiography is that one, radiation exposure is there. Second one, the contrast which is used in this. So the contrast reactions may be possible one. Thermography is another less heard one, but commonly used in screening the breast cancer and all, and also for any vascular inflammation, where the infrared sensors are used to detect the heat in the body. With that, we can also track the blood flow on the skin surfaces because of the heat, thermography, heat. So it's a non-invasive one and radiation free. That is a major advantage. But the limitation is not widely accepted as a standard diagnostics tool. So that is the major disadvantage with this. Almost if we just understand and compare all these 12 types, so far we have seen 12 types. In a nutshell, if we...
Same thing.
Pardon?
Doppler effect, 2D echo and all this thing they do, 2D echo and all this thing comes under sonography only.
Yes, yes. So in the case of X-ray, it uses ionizing radiation to capture 2D images. So commonly used in the bone fractures, chest infections, lung to study the lungs and bones, joints, and also dental imaging, the hard structures. Advantage is the fast one, inexpensive one, widely available. In the case of ultrasound, where the high frequency sound waves are used to produce the images, It's very safe. That can be used during the pregnancy also, and highly used, preferred to study about the abdominal organs, thyroid, blood flow, Doppler, and also the breast lumps and all. And the advantage is that safe, no radiation, and then it is portable and real-time imaging is there. CT scan combines many X-rays images to form detailed cross-sectional image and used across the body to study head injuries or chest or lung problems, abdominal organs, cancers, fractures and all. It's a very quick one, detailed one, and 3D view of the organs you can get. MRI uses magnetic fields and also the radio waves to create detailed images, and similar to CT, this also can be used in all the areas, but there is no radiation in that MRI. It's a very detailed one, but no radiation. That is a major difference. The image is also very superior compared to CT one. PET scan is it uses a radioactive tracer to show how organs and tissues are functioning. It's a functional one. So highly used in cancer detection, brain function, heart disease and all. So the functional images, it shows the metabolism, and this is used along with CT or MRI. Then we have seen about the mammography, where the low dose X-rays are used on the breast mainly to detect any breast cancer, and high sensitivity for the breast tumors is a major usage area of this mammography. Then we have seen DEXA scan, that's bone densitometry, using low dose X-ray here also to diagnose the bone health, bone strength. Fluoroscopy is a real-time moving X-ray. It's like a video one actually, to examine the GI tract related problems. Barium swallow, then angiography and joint injury injections. Then the angiography is the one where the imaging of the blood vessels using contrast dye, by either CT or MRI or fluoroscopy is done to study about the aneurysms or the blockages, to study about the blood vessels. Can get to see the precise view of the blood flow. So to summarize this, which is to be used depending upon the condition, depending upon the requirement, and depending upon the level of study that is needed, whether it is CT or PET or MRI or the X-ray related one, all those things. So we need to properly assess and then choose which one is to be employed here. And it can be used in diagnosis, treatment, and also to monitor the prognosis. So the scan is done, the report has come. So how a report normally it would be? A report will contain what? Major. One, it will have the details about the patient information. That is the name, age, gender, then their ID number or something, and also the date of scan. That is general information about the patient will be there. It should be there. And then clinical history or the indications. That is the reason for the scan. Why it is being taken, for what condition this is advised or prescribed. and then the technique by which this is done, how the scan was done. In case of MRI, with contrast, without contrast, and the findings. That is the important one. A detailed description of what the doctor or the radiologist sees there. That is very important. And then impression or conclusion. Normally, this is the one immediately first we will get to see this. So what the impression or the conclusion they have said. So it's a summary of the key findings in simple terms. So normally often what the doctor focuses on is this area only. And after seeing this, we will have to go through the complete findings to understand exactly what it is. And recommendation in some cases, it is mentioned for further tests or follow-up or to match with clinical examinations or something. So how to read each section? In the case of clinical indications, which tells you why the scan was ordered, and with that you can understand the context of the findings. And then the technique to know the accuracy and whether any contrasts are used or not, which technology is used there. Then findings. It will be too technical with related to anatomy. So you need to know the anatomy of it to exactly correlate with exactly in the body what is happening, what is present there, where in the internal organ. Some terms commonly used are like normal or unremarkable, means nothing is there, no findings, no abnormality. It's normal. They mention something like mass, a lesion, or nodule. Then some kind of a tumor, abnormal growth is there. That is the meaning of it. If they mention something like effusion, so effusion is related to fluid collection. Edema is swelling. Fracture that we know. Stenosis. Stenosis is narrowing of the passage. It may be the blood vessel or it may be the spinal canal, spinal stenosis. Then enhancing, wherever the contrast dye is used, the abnormal tissue which takes more contrast dye is enhancing. It's commonly used wherever the dyes are used. Under the impression part, which gives you the summary, like some example, no evidence of intracranial hemorrhage, or something like mild sinusitis seen, something. It's a summary. It's the overall
They
what to say,
always mention
epitome.
that correlate with the clinical correlation advice.
Normally
Clinical correlation advice.
normally they mention because we need to check
That's
with
correct.
other methods
हाँ,
and to cross check that.
एंड में वही लिखते हैं.
हाँ, generally. So some of
That is
uh, it's related to the density. Sometimes they may mention like hypodense or hyperdense, especially in the case of CT scans.
exactly.
It is the darker or brighter areas. That is less or more dense tissues. That is the meaning. In case of MRI, signal intensity they mention. Again,
आपने
some
एक्सरे कवर नहीं किया था? एक्सरे, आई मीन ईसीजी, ईसीजी।
ECG is when. Yeah. So that is not like a scanning kind of a thing, imaging kind of a thing.
Yeah.
It's just entirely different method. Bright or dark appearances in the MRI, which can indicate different tissue types. Because of not chest X-ray, consolidation would be the term normally they use. It is lung filled with fluid or infection like pneumonia kind of a thing.
These are
Herniation normally is mentioned in the case of disc, herniated disc, in the spine study. Calcification, so calcium deposits. So how to interpret commonly? First of all, we should not get panic if something sounds scary. Some findings may be normal with the age. So we need to compare so many other aspects. If at all any previous scans or the images are there, you need to compare if available. So the findings, for example, if we can give from some report like,
so many words are there, which is sometimes not we're not able to interpret properly. In case of 2D echo, in case of ultrasound also,
ultrasound commonly
so many
that
things
is
are
the
there.
problem. Not
Yeah,
with MRI or the CT,
yeah,
mostly with USG,
yeah.
ultrasound. So
And also,
for an example to study, we'll say something like, findings. There is a
yeah,
1.5 centimeter nodule in the right upper lobe
mm.
in the lung and no pleural
In
effusion.
case of,
Heart and reaction appears normally.
so what does it mean, sir? In my
Means,
case, USG, abdomen, and pelvis,
okay,
impression was grade 1 fatty changes, a grossly post prostromegaly with median lobe hypertrophy seen
okay,
in the base of the urinary bladder, a
okay.
mildly thickened and irregular urinary bladder wall, few left renal cortical cyst,
Just post,
post void residue
just
is so
you
and
just
so.
post that in the chat box so that everyone can see, and then we can discuss about it.
Exactly. Yeah. Acha. Should I send the
Not sending in the chat, you just mention
okay, ठीक.
now itself so that we can
Okay.
check that.
Which so many groups are there? I don't know which group I have to send it.
Just type it.
Which group I should send it?
No,
Acha,
here itself, not to the group.
Acha, here only.
In the Zoom itself, in the chat box, you type
Acha.
it so that everyone in the
Oh,
session
once.
can get to see.
Not well versed in the typing in the mobile.
Sir, you can share the screenshot also if you have or image something. You can share that
Yeah,
in chat.
I can say I can get the scan and send it in group.
In the which group you will send it?
You say which group you ask me to, I'll send in that group.
You can
Joshi
share it
Kerala,
in chat also.
Joshi
Actually, the
Kerala group.
images can be. Images can be shared in chat also.
Oh. I don't know.
Take a screenshot of it and you can paste here, right?
Yeah. Acha, but here only I can take screenshot. Mobile, okay.
Otherwise, you just tell I will type here. You tell,
Okay.
sir.
One, it is mentioned that grade 1 fatty changes
Wait, grade
and
1. Wait. Grade 1
fatty
fatty changes.
changes,
Okay.
and then grossly prostatomegaly with median lobe hypertrophy.
Grossly. Wait, sir, I am typing.
Okay.
Grossly.
Prostatomegaly
Okay.
with median lobe hypertrophy
Okay.
seen jutting into the base of the urinary bladder.
You spell it?
Uh, Jutting, Jutting. Maybe it is going down, I think. Base of the
Jet,
urinary bladder with
jetting down.
intravesical, uh, getting getting into the base of the urinary bladder. So
Okay.
I can screenshot, scan it and put it in the group. You can share it that also. That will be better instead of typing it.
And now it is for the real-time study by everyone. What
Okay.
they
Okay.
understand.
Yeah. And then with intravesical projection, S stroke O, what does it mean? S stroke O, S by O,
Suggestive of.
suggestive of meaning enlargement of the prostate.
That is mainly in the case of BPH, it is mentioned like that.
Yeah, yeah,
BPH is
yeah.
the
Benign.
benign
Benign
prostate
prostatic.
hyperplasia.
Exactly.
BPH,
At
it's a
post,
non-cancerous
yeah,
prostate enlargement.
mildly thickened and irregular urinary bladder wall.
Okay. So urinary
And
bladder is also impacted with this. Okay.
few left renal cortical cyst.
Okay. So there is a tumor there in the renal.
Yeah,
There are two
cyst,
types,
no?
not two
Acha,
types, two layers. One
acha,
is cortical area and the one is
acha.
medullary area. So cortical is the
Yeah,
outer one,
cortical cyst.
medulla is the internal one. That means it is in the
Acha, acha.
medullary area. Depending upon
Okay,
the location of the tumor
okay.
in the
Uh,
kidney. If it is in the medulla, then
okay.
the filtering itself will be fully hampered there. If it is a
Acha,
cortical one, filtering will be there, but will interfere with the regular metabolism of the kidneys. That means that this
acha.
patient, based
Okay,
on
got
this
it.
report, will be having the problems like no frequent urination. He is a male
No.
patient with
Yeah.
the urinary inconsistency or incontinence, and
Yes.
there will be problem or the mild pain there in the lower abdomen,
Yeah.
and there will be a problem in the urinary production also. So
Okay.
likely this may develop into in future if you allow that same
Future.
conditions
Yes. Yes. Yes.
into
Yes.
a CKD.
Yeah. Acha. And post void
This guy will
residue
be
of
having,
201
what
cc.
about the liver? In this case, the person may be having the fatty liver condition also.
The post void residue, what is say? They say no that after you before
Pass out the urine.
sonography, uh, yeah, no, you have
Volume
to
will be
take
more.
water.
How much is
Take
the
1 liter
CC
of
they have
water. One
mentioned?
liter of water. Yeah, 201 cc. Pre 312 and post is a 201. That is the difference is
That
there.
means only one third is getting evacuated. Two-third remains there in the bladder itself.
Exactly. Yeah.
That
See,
means
that is true, sir.
always
But
the
the point
problem
is
will
that
be. And in
uh,
such patients, if you check
yeah,
the urine
uh,
analysis, complete urine analysis,
uh,
you can get to see it is
uh,
the turbid. If you have
Yeah,
got the
nothing.
urinary report also,
Urinary
the
is
urine
clear.
will be turbid only, because
Acha.
always some majority of the portion of the urine is retained
Hmm.
there inside, and
Ah.
the calcification problem will be there, and because of that
Hmm. Hmm.
stagnation of urine for
Ah.
quite a long time, there will be
Acha.
depositions there in the wall. That's why the wall is
Uh-huh.
also irregular.
But acha. But the what they say normally these people say you drink water, but then within 15 minutes, 20 minutes you go for a urination के लिए. But it doesn't normally it doesn't unless you don't get fully discharged. No, after the immediately it takes time. After drinking for 1 liter water, say after 15 minutes you go for this thing. Yeah, it is wrong sometimes. Sometimes it gives wrong results. You
It
may
is
not have
not.
that sensation to pass the urine.
Actually, there are two things involved in that. That is
Uh,
related to the urgency of the urine. One is
yeah.
that the
Hmm.
sensitivity of the nervous system, autonomous nervous system, which is located there in the
Yeah.
urethra.
Uh,
Urethra is the tube from the urinary bladder
yeah.
till
Yeah.
the outlet.
Hmm.
Okay. If the pressure in the
Yeah.
bladder is more,
Hmm.
the sphincter which is there, how long it can hold, that is one
Hmm.
problem. Second, if the person is having
Exactly.
prostatomegaly,
Hmm.
where it compresses
Hmm.
the urethra and also the bladder's opening
Hmm.
there, again that problem will be there.
Acha.
Urgency will be there.
Hmm.
Even with a little
Hmm.
quantity of urine accumulation in the urinary bladder, the
Hmm.
pressure will be like, as if it is full bladder full of urine. But when they go, because of the
Exactly.
compression of the
Ah.
prostate glands over the urethra,
Exactly. Yeah. Yeah.
they will
Yeah.
not
Got it.
have immediate passing of the urine. It will take
Exactly.
time, and the force will be
Yeah.
very less. And sometimes even
Exactly. Hmm.
at the end also it will be like trickling. It will be just dropping there only.
Exactly.
And they
Yes.
will
Yes.
not have the
Hmm.
feeling like they have fully passed the urine.
Exactly. Yeah.
Then with because the autonomous nervous system which no works on this, the signal
Hmm.
is getting impacted because of the prostatomegaly. So what
Okay.
happens? You will get to experience the urgency very often.
Acha.
The bladder
Got it.
one on one side it tries to push out, whereas the mouth
Hmm.
is
Muscles are
fully,
not.
the
Hmm.
mouth or the outlet,
Compressing it.
it is compressed. It's unable
He's
to
compressing it. Ah.
unable to fully,
Pass it.
yes, evacuate the
It
entire volume.
exempt it. Correct. Got it.
That is the problem.
Yeah.
If the
I
patient
just.
is having
Yeah. That's
diabetes
what. That's
also,
what I mean.
it will have other
Ah.
major
Exactly.
issues over a period of time. Frequent UTI will be
Yeah.
there. There will be some other problems related to
Yeah.
infections.
Yeah. But he doesn't have any doesn't have diabetes. He doesn't have
No,
UTI
not this
प्रश्न
guy.
है. Everything
Generally,
is
I'm
okay.
telling. If it is
No
there,
frequency. Night also is not there. He doesn't get up in the night. Doesn't get up in like hardly once in a month or two. He goes in the get up in the night. There's no frequency is there. Otherwise
normally
okay.
with our
But
treatment, normally we will not take more than say around 10
hmm,
days, maximum 15
अच्छा
days.
अच्छा
Whatever may be the level of that urgency, or
अच्छा
5 times, six
yeah
times in the night and all,
hmm,
we
yeah
normally stop normally. Afterwards, they resume the normal life.
yeah.
At a glance,
No, I'm just referring my own case. That's why.
which will come down with
And
our
it's going on for
comprehensive
last
treatment.
yeah. And again, the PSA is also not 4 point. You had correlate with the PSA also, no?
PSA, if it is mentioned like BPH, then there is no need to go for no PSA. PSA is the prostate specific antigen, which is
Yeah.
more if any prostate cancer is there. That is the marker
अच्छा
to
अच्छा marker.
study the availability or the existence of the prostate cancer.
Okay, ठीक है.
PSA is the marker for prostate cancer.
normal range is 4, it comes around 5, 5.2 ऐसा कुछ है.
ज्यादा है तो then it is developing into
It's
a
not
cancer.
much. Of course, maybe due to medicines or something, maybe
PSA
suppressing
will
it.
not be more with the medicines
Come
and
over.
all. That is the antigen, it's a marker.
Yeah, that is true.
PSA is the
Yeah,
marker. If it
exactly.
is more than that level, then you have to take immediate treatment in a holistic manner.
Sir,
So
mammogram
about the 2D echo report, 2D echo. The 2D echo report, I'll just cite it. If you mention it, I'll mention it here. Impression is that I'm just reading the impression only. A normal LV systolic function.
Okay.
That is 60% is there. No regional wall motion, abnormality present.
Okay.
Mild concentric hypertrophy.
Okay.
Sclerosis, aortic wall with trivalvular AR. Mild mitral regurgitation. What is that?
Mitral regurgitation. Mitral is the wall.
Regurgitation.
The
Mild.
bicuspid wall that is located
What is
between
regurgitation?
regurgitation is just sending it back. It's not fully closing.
Acha. Got it. Reverse. Moderate tricuspid regurgitation with mild pH.
Okay. Tricuspid valve is the one which is there between the right ventricle. And that's
normal aortic arc. Normal aortic arc.
For that, you need to know the anatomy of the heart. Then only you can understand exactly.
Yeah, exactly.
Okay.
And no clot, vegetation, effusion.
Effusion, okay.
Vegetation
So
and
pericardial effusion is not there. So no pericarditis, everything
but it
is
doesn't
okay
detect any doesn't it detect any what do you call blockages. It doesn't
For that
say,
you
no?
need to go blockages
You
and
have to
all
go
only through
angiogram
only. With the dye only you
no
can
other
study about that.
test.
Doppler is to study about the performance of the heart. With this, if the EF, that is ejection fraction, is 60 or 65 and all, it is a good one. If it is coming down, then the ventricular performance is less. That may be due to any blockages there in the myocardial arteries.
Okay.
Any other
Another thing
doubt?
is
Any
that
other person?
osteoarthritis.
Osteoarthritis and all?
Please, sorry, carry on.
Osteoarthritis.
Yeah, moderate
OA.
Both knee joints.
That's what OA can be studied by this X-ray very well that we can get to know. Furthermore, imaging if you need, then CT scan you can get.
CT scan will be better.
But OA and all.
I had knee pain. Now it is okay.
It's not like RA. RA is rheumatoid arthritis.
Yeah.
Unlike OA is osteoarthritis. Rheumatoid arthritis is caused by the autoimmune condition. So that will create deformities and that will be say bilateral one. If you get in this particular finger, the particular joint, the same will be there in that other joint also. Whereas OA will not be like that. That is a major differentiating symptom between the OA and RA. Madam was asking some doubt.
Sir, in mammography, they'll write Birads 1, 2, 3 like that.
Birad is the scale, like Quarads, Birads is the scale in which, depending upon the condition of it, they will say what is the condition. It's normal or moderate or abnormal, and it may develop into cancerous one. That is the scale, Birads.
How many stages, sir? 1, 2, 3, I saw.
I think it is up to 4.
Okay.
Birads. What it is mentioned exactly in your thing?
1 minute. Huh? Dense fibrolateral parenchyma in both breasts
By rats, two. Few mild enlarged bilateral and axillary lymph nodes.
Okay, okay. Which, no, the number they have given? 1, 2, 3, 4.
By rats, two.
2
They
is
given.
nothing. It's non-cancerous. It's a regular one. Nothing. The risk of cancer is 0%. Don't worry.
Okay.
1 and 2 and all. 1 is almost negative. 2 you need not bother. 3
Okay.
probably benign only. Almost
Okay.
90, 95, 97, 98% it will be normal benign tumors only. And 4 and above, that is 4 only is there. 4 A, B, C, D they may mention, or 5 or 6. Up to 6 I think it is there. 6 is 100% cancerous. And 5 almost 95% it is cancerous. In 4 suspicion is there. Even in 4 also they may mention some cases like ABC.
Mm.
A is less suspicion, B is moderate up to 50%, or C is highly suspicious. 5 and 6 almost. 6 confirmed. So for 2, whose report is that? 2?
It's mine only, sir.
बेफिक्र रहिए. Nothing.
Sir?
No problem.
Okay, thank you.
No problem.
Madhavi.
Okay, sir. Yes, sir.
You are from Tamil Nadu or?
Sir, I am from Telangana, sir, Hyderabad.
Hyderabad, I think. Hyderabad.
Okay. So no worries at all. Nothing. Don't worry.
Thank you, sir.
Normally, what I advise the no female, we cannot say that patients, almost all more than the age of 35. Regularly, you
I am in 51, sir.
oh, 35 it is advisable. Then above 40, 50 and all, if at all you have got any the feeling like hard masses, the best and very effective one is that you take castor oil. Okay, you apply the castor pack and then
Okay.
regularly massage whatever because the lymph stagnation should not be there.
Okay.
You drain the lymph pathway properly. That is the basic and fundamental and very effective one. Keep disturbing that, keep massaging that, let the circulation of lymphatic drainage should be ensured. That is very important.
Yes, sir. Thank you, sir.
Welcome. Any other reports or something where you have come across with some reports and you want?
Sir, I have one query.
Yes.
Good evening, sir. Sir, if
Very good
the
evening. ये
there
तो
is
अनिशा जी
fibroid
के वॉइस
mass,
की तरह लग रहा है.
yes, sir.
With the voice we can identify. Yes, go
Yes,
ahead.
sir.
बोलिए.
So there is fibroid node in the thyroid and as well as in the breast, sir.
Okay.
It is written as benign, but it was written as FNSC is suggested, sir. So should like person go for the FNSC, or what will be the benefits or contraindications, sir, for the FNSC? When should go and when to avoid, sir?
Exactly what they have mentioned.
For like my the fibroid mass is there, nodule is there, fibroid nodule is there, and FNSC, that fine needle aspiration cytology.
Correct.
So it is advisable. But the
So it's
thing
a
is written as benign only. Yeah, it is not increasing in size since last 5 years. So should the
kind of
person
a
go for that?
biopsy only.
So like it is advisable, or there are some harm related to it or something?
Definitely harm. Anything externally if you do, even whether it is a, let us not consider something like, malign, cancerous, this, that, and all. Any kind of abnormal growth. What happens in the body has got its own intelligence, and the cells, if any unwanted abnormal growth is happening, so it will try to cover up that and try to suppress the growth to maximum extent possible by the body itself. So it's kind of, protective shield or the cover. a tie. It is there. When you poke, pierce that, and you disturb and take some cells, you are just denting the protective shield. In case of the cancer patients and all, you see, after the biopsy, the spread will be very, very high and it's phenomenal because of this one. Because till that period, still any invasion is being done. That protective shell is there to just try to contain in that particular area only. It is not allowing to spread. Once you pierce, damage the cover, take some tissues out, then it's bursting out and mixes with the lymph and also the blood. It passes throughout the body, and wherever the susceptible cells are there, it fits there, grows there, and metastasis comes. So if you ask me personally, I will never say to go for.
Even if the biopsy is not
That's what
advisable.
FNSC is biopsy only. Just biopsy is examining. Here, the extraction of that particular tissue.
Acha, okay. Tissue.
From the tumor, with a fine needle, you are just taking some part of the cells to study under the microscope to see the nature of it, whether it is
Okay.
benign or malign, or even to detect any kind of infections, H. pylori kind of a thing and all, or any inflammations or cysts, or to be done any surgery or not. With this, they can do that. So, in my opinion, no need. Whatever, whether it is benign or malign, our aim is to first control it, reduce it, shrink it,
Control.
remove it naturally. How it has come from nothing, it has to go to nothing, reverse back.
Yes.
That should be our objective of the treatment.
That is why in case of breast cancer, when the breast cancer is removed, it spread fast. It's very fast.
You do the biopsy immediately, metastasis comes. Because you are damaging the protective cover itself.
Yes, correct. Nature, if you're disturbing the nature, then
That's it.
it spoils it.
Okay, any other doubt?
Sir, I have one more doubt, sir.
Wonderful
Yeah.
class.
Sir, I have one more doubt, sir.
Yes,
Abdominal scanning size is 51 into 36 into 32 mm. Antiverted, normal in size, shape and echo texture. Endometrial thickness measure is 9.2 mm. Cervix appear normal.
Okay. It's a normal study of the uterus. Nothing to worry.
Endometrial thickness is 9.2.
That we need to study with the period, menstrual cycle.
Yeah.
At what stage it is, whether it is during
I
the
mean menopausal stage, sir.
not the
After
menopausal
3-4
stage,
months of
not the
period. Yeah.
menopausal stage. There are two phases in the menstrual cycle. The first half before the ovulation, that is follicular phase. This is the phase where the estrogen will be more. Estrogen is very much needed for the endometrial thickness. So during this phase only endometrial thickness will happen. At the ovulation, this starts declining and progesterone comes up. So where the FSH will come down and LH will go up in the body. LH is the luteinizing hormone. LH and FSH are secreted from the brain, pituitary. And the estrogen, progesterone are secreted from the ovary. So the entire menstrual cycle, for example, 28 days period, normal cycle, one female is there. So from the date of menstruation, you go before to that, 14 days. That 14 days prior to the menstruation is the ovulation date. For example, if a person who is having 30 days or 32 days of menstrual cycle, then it is 28. 14 days you need to go. Go ahead. 18. So 18th day is the ovulation date. So after the ovulation, that is luteal phase. Before to that, that is called the follicular phase. So at what phase you have gone for this, that matters. Based on that only, you need to study about the endometrial thickness.
Yeah,
This
but
also
my
will indicate.
my period cycle was abnormal, sir. Now I am in 51.
Okay.
Sometimes that may be 3 months, 6 months. I can't count that.
Okay. In such cases, we need to check what is the level of estrogen, progesterone, and
Okay.
LH and FSH. Based on that only, we can correlate whether this is normal or less than normal or more than normal.
Okay.
Immediately, we should not jump at the conclusion that this is thin or thicker, and accordingly, we need to consider that this as the health issue. No. So various aspects we need to take into consideration.
Okay. Thank you, sir.
Welcome.
Very nice explanation, sir.
Nice.
Sir, may I ask one question, please?
Yes, ma'am. How are you?
Sir, smiling, I'm fine.
Have you come
What
from
about you all?
abroad?
Yes, sir.
Great. Yeah.
Sir, as the discussion was going on, endometrium thickness is related to menstrual cycle, estrogen and progesterone level और जो पिट्यूटरी से हार्मोन सिक्रीट होते हैं उससे
Yes.
मेरा कंसर्न है कि whenever a lady enter in a menopausal phase और
Yeah.
उसका मेनोपॉज हो गया है मतलब मेंसेस रुक गई है तो
Okay.
आफ्टर दैट एवरी लेडीज हैज टू गो विद दिस एंडोमेट्रियम लेवल जो एंडोमेट्रियम का थिकनेस है वो कम हो ही जाएगा
Yes.
तो उसके लिए क्या प्रिवेंशन मेजर होते हैं क्या या डज इट लीड्स टू एनी कैंसरियस स्टेट और नो
Okay. I understand your question. The thing is that first, menopause means if the period is not there for consecutive 12 months, that is at least 1 year. If the period is not there, then you consider that, yes, menopause. It's not that 3 months, 4 months, 6 months afterwards you are getting spots, that and all, maybe on the verge of getting into menopause, but when menopause has not happened. So for at least for 1 year, if you don't have any periods, then it is the menopause stage. So after the menopause, what happens? The hormones from the pituitary, that is LH and FSH, the level will go down gradually and simultaneously. If FSH is not there, then automatically the estrogen will be less. And if LH is not there, then there will not be any ovulation, and afterwards the progesterone level also will go down. When these two are not there, then automatically the endometrial thickness will be reducing. Afterwards, even the size of the uterus also will shrink. As the age progresses, the size and shape of the uterus will not be as like it was in the fertile period before the menopause. So it is a normal aging process only. There is nothing to be worried. That's why normally we see the osteoporosis when I was discussing about the imaging, like to study
Yes, sir.
the bone density and all. The estrogen plays a crucial role in the vitamin D metabolism and directly into the calcium metabolism also. So if the estrogen level is already less due to PCOD mainly, then what happens? The calcium and vitamin D level will be less, and automatically the bone will not have that much of osteocytes to produce strong bones. So that creates over a period of time the osteoporosis kind of a thing. One. Second, you need to check the level of PTH mainly. Calcitonin is the hormone from the pituitary, and also the parathormone or the PTH secreted from the parathormone, the parathyroid glands. If that is directly regulating the calcium level in the blood, if less calcium is there, then automatically to maintain that calcium level in the body, because calcium, magnesium, sodium and potassium are critical one for the metabolism. If you see many of the beta blockers like calcium channel blockers, that and all have serious implications. That means the calcium is one of the important uh, element in the cell metabolism. So if low calcium is there, the hormone, parathyroid hormone will be secreted more. If that is more, then automatically it takes more calcium from the bone and pushes into the blood in order to maintain the calcium level. Then automatically your bone density will go down because of this. So on both the aspect we need to check.
So due to this excess calcium secretion in the blood level to maintain the calcium level, does blood get thicker due to this calcium?
No. Blood thickness and no calcium alone. Calcium is one among so many other more than 80 minerals.
Yes, right.
So that
And one more
alone will
question,
not
sir.
make calcification will be there, and it interferes in the normal metabolic activities of the heart, kidneys and all.
Yes.
And thickness is mainly influenced by the hydration level and also the cell production, that is your hematopoiesis, the level of hematopoiesis.
Hematopoiesis, right, sir. सर यहाँ पे ना सर हमारे बिल्डिंग में एक हो गया that lady is 87 year old 87-year-old and she got the cancer uterus cancer now. तो कौन सा भी एज में हो सकता है सर यूट्रस कैंसर मतलब
Yes.
आई वाज सरप्राइज टू नो कि 87 मींस अभी उसका लाइफ एज एज चल रही है ना सर
Any kind
हेल्दी
of
नहीं है ऐसे कुछ नहीं है
okay, any kind of tumor, if we approach based on our acupuncture theory, any kind of tumor is on account of stagnation there. And first the chi will be stagnated. If chi is stagnating, then automatically chi will not be there to push the blood. So movement of blood will not be there, then blood stasis will come. So if a person at the age of 60 or 65 is getting uterine cancer, well before the menopause, there will be a lot of issues with her menstrual cycle and also the uterus condition. And we need to check with the liver also, because liver supplies the blood to the uterus. So we need to have a comprehensive approach rather than just by seeing that at this age this has happened. Can it happen? Very well, because the stasis is so severe there over a period of time that becomes a cancerous growth.
बट सर दैट कैंसर वाज साइलेंट सर पता ही नहीं चला जब फोर्थ स्टेज आ गया ना तब पता चला
So most of the cases of the cancers, unless the symptoms are there, because for this person there is no period also. After menopause, uterus, there is no, however, there should have been the occurrences of some spottings there, here and there, before actually they identified the cancer. Definitely. You just check with her.
what sir what you have said your voice was cracked that time
Spotting, blood spottings.
okay अच्छा okay
Sir, as per our pathy, there should be some bluish or purple something on the tongue, no? If it is there for a long time, like stagnation or stasis is there.
ऐसा कुछ नहीं है अनीशा ऐसा कुछ नहीं है।
अच्छा,
स्टैसिस ऑफ ब्लड वी कैन चेक विद द लीवर, वो तो टेम्पररी होता है। लेकिन अभी ये एज में उनको स्टैटिस नहीं था, मतलब शी इज फिट एंड फाइन, कुछ भी बीपी शुगर भी नहीं था सर उनको। वही हमको सब सरप्राइज हो गए जब आई केम टू नो ऐसे। सर वन मोर क्वेरी आई वांट टू आस्क, इज सर इज देयर और सर लेफ्ट? हेलो सर। हेलो
Sir, you are muted.
ये तो I'm not
सर,
muted.
yes, sir. Now audible.
Audible?
Mm-hmm.
no.
Yeah.
Sir, again one question.
Yes. Hello.
या कमर में दर्द, ये सारे सिम्टम्स क्यों दिखाई देते हैं सर फिर
Please
मेनोपॉज
come.
हो गया है तो भी?
Please come again. Please come
Sir,
again.
इसका
इसका
screen
रीजन
again freeze हो गई है, I guess.
हाँ सर का स्क्रीन फ्रीज हो गया है।
Hello. Hello.
यस सर, नाउ नाउ हियर
Some internet connection says that it's unstable. I'm sorry. Yeah. Okay. What is the question?
सर माय क्वेश्चन इज दैट आफ्टर मेनोपॉज फेज ऑकर्ड,
Okay.
सपोज एक लेडी को 3-4 महीने या 6 मंथ्स तक मेंसेस नहीं आया है, तो वी
Okay.
कंसीडर इट एज अ मेनोपॉज।
No, 1 year.
अगर
That's what I said. 1 year you need to see, not 5 months,
अच्छा,
6 months and all.
लेकिन उसको सर प्री मेंस्ट्रुअल सिम्टम्स तो रहते हैं,
वो
मतलब
तो
एवरी
होगा.
मंथ।
That will be there well before the onset of menopause.
लेकिन सर ऐसा है ना कि वो मतलब बिफोर चाइल्ड बर्थ
Hmm.
मेनी ऑफ फीमेल्स ऑब्जर्व, आफ्टर चाइल्ड बर्थ इट हैज वैनिशेस मेनी इन केसेस, बट उनको भी ये क्यों दिखता है फिर? उनके केसेस में भी दिखता है सर ये, इट इज वाई।
दिखता है? क्या दिखता है?
प्री मेंस्ट्रुअल सिम्टम्स सर।
Actually, that premenstrual syndromes, there will be a lot of fluctuations in the hormones. If you see in the life of a female, the major aberrations or the imbalances or the changes of hormonal pattern happens, one at the age of puberty, at the time of puberty, second after marriage and conceiving, and third after delivery, fourth at menopause. A lot of changes. Hello?
Yes, sir. Listening. Yes, sir. Listening.
Yeah. So we'll have to assess into various angles that why such kind of aberrations are happening. Maybe because of the not ovary, but mainly the ovary and the thyroid related issues, and also the pituitary related issues. This may happen.
Sir,
Any
my
other
question was
questions?
कि
Does it
अभी
lead
जैसे
to cancer, sir? Does its symptoms lead to cancer?
We cannot say that directly. If this is there, then you will get into cancer. For example, anyone anyone individual, if given a time, put into PET scan, at least 10 cancer zones will be there in the body, at least 10 cells. But they will
Actually,
not
sir,
develop
that's
into
why I'm asking.
cancerous clinical cancer, because as long as the normal immunity is good and the hormonal pattern is correct and the metabolic activities are proper and the lifestyle is supporting to contain that, no, the cells, it naturally dies like any other cell and goes off.
Yes, sir.
So every one of us are having the cancer cells within us. Not 1, 2, at least 10.
Right, sir. Sir, here in Tata Hospital,
One more.
I
I want
used
to
to
ask one
go
more.
for
What are the
social
demerits
service.
of the radiation?
Pardon?
So what are the demerits of radiation? आपने कहा radiation है चाहे what
बहुत है,
क्या exactly
बहुत है.
what is happens? Because we don't have to do a
It
lot of X-rays and all those
damages
things.
the cells, it damages even the DNA and the chromosome inside the cell.
अच्छा.
बट सर वो तो
It creates mutation also.
कैंसरस होने के बाद जो रेडिएशन वगैरह लेते हैं उससे होता है ना सर? ये एमआरआई वगैरह निकालने से भी होता है सर ये सब चीजें?
होता है.
एमआरआई या फ्रीक्वेंट एक्सपोजर टू
Constantly
मैमोग्राफी?
X-rays, and yes, constantly if you are exposed to the rays, then yes, you are more prone to get cancer.
सर देन एवरी लेडी शुड डू दिस ना सर? तो क्या करना है हमें? तो हर 6 मंथ में हमारा चेकअप होता है सर ये?
जैसा तो नहीं है.
हाँ
Required.
That's been told to you that every 6 months you
Unnecessary
have to
not
get to
X-ray should not
do
be
that.
taken.
No need.
Why
ओके
should it? Not
सर
required.
ये तो टाटा हॉस्पिटल में बोलते हैं सर 35 के बाद एवरी लेडी
वही तो
शुड डू।
बोलेंगे ना, उसका धंधा चलना है ना. सबको
नहीं
आ
सर,
जाओ, सबको पैप स्मीयर कर लो, सबको वो सर्विकल कैंसर के बारे में. इससे पहले तो पैप
यस
स्मीयर क्या
सर
होता किसी को
एग्जैक्टली।
पता नहीं था.
मुझे
उसको
तो
धंधा
पता नहीं था
चलाना
सर
है,
वो
इसलिए
पैप्स
वो
टेस्ट
बिग
वगैरह
मार्केट.
क्या है।
I should not and I cannot comment on that. That's what I said. Why you want to go for the pap smear and test there only? If anyone put under PET scan, you will have at least 10 cancer cells there in the body,
That is
not one. But they will not develop into a clinical one. उसको जैसा कैंसर है, सेल्स है इतना, वो 10 तुम्हारा वो बदन में है बोलो, वो डर के मारे पूरा उसको क्या पैरासिम्पथेटिक खत्म हो जाएगा, सिंपथेटिक मोड पे आ जाएगा, पूरा नॉर एपिनेफ्रिन एपिनेफ्रिन सब कुछ आकर खेवस हो जाएगा बॉडी में. बॉडी विल बिकम मोर अल्कलाइन एसिडिक एंड it will be less because of the sympathetic activation. There will be less saturation or the oxygen level in the body because shallow breathing will be there. The heart will be more. All those things will be very conducive for development of or spread of the growth of the cancers.
सर वन ऑफ आवर कलीग सर पासेस लाइक दैट वे। ऑफिस में थी सर, हम
Every
नॉर्मल
patient
चेकअप के
you
लिए
see, the
गए सर।
cancer patient, after identification only, they die. Because
यस
of the
सर
fear,
दैट
the
इज व्हाट।
body changes.
हमको किसी को
mentally
पता नहीं था
mentally
सर,
affects
हमारा
people,
रूटीन चेकअप हो
right?
गया
It is
और हम
also
सब
mental effect.
ये